The World Health Organization, the WHO, estimates that in 2021, more than 300,000 South Africans fell ill from TB, while 56,000 died from the disease. The latest statistics show that South Africa remains among the top 30 countries in the world with a high TB disease burden. There were, however, positive developments before the COVID-19 pandemic. TB incidence in the country declined between 2015 and 2020. But the drop of 11% is still only half of the 20% target set by the WHO.
What we set out to do was to increase the number of people accessing a TB diagnostic test. We set out to improve the quality of care. We set out to improve overall retention and care and people completing therapy. What we didn't factor was a pandemic that will come and disrupt a strategic plan.
But all is not lost. Naidoo says the TB recovery plan has focused on key areas to bring the country back in line with the WHO's End TB strategy.
And we've had to rethink how we implement the program. And the government remains committed. We use the latest evidence within the strategic plan in order for the common person to benefit from all the research that is underway globally. We have the best drugs that are available to treat drug-resistant TB. There's newer regimen coming in to treat drug-sensitive TB, a shorter regimen of 4-month duration. So we do a lot more to enhance the quality of our program.
But the challenges remain. The TB burden is mainly driven by HIV, poor living conditions and late presentation to health facilities.
The biggest challenge we face is the huge burden of HIV. People living with HIV have a heightened risk of TB disease. If you do not have HIV, your risk of getting TB is 10% for your entire lifetime. But if you're a person living with HIV, your risk for TB is 10% for every year that you live. So the biggest challenge is the TB in people living with HIV. It's a tap that we haven't quite been able to turn off. The complexity of HIV-associated TB is the high mortality.
Studies have shown that tens of thousands of people sick with TB in South Africa are not diagnosed. This 26-year-old TB patient from Umlazi is a volunteer in one of CAPRISA's research projects in Durban, where there is a high disease burden. He was already very sick before he started treatment.
I started 14 November because I don't feel well even at work. There's no appetite. Every day by trying to eat, I don't even eat. Yeah.
The Department of Health's Target Universal Testing Strategy, which requires testing people living with HIV, people who had TB and close contacts, is a way to address this. And improving on this approach, described as test and treat, are new guidelines for those among the high-risk group who, when testing negative for TB, are treated with TB preventive therapy.
TB is a disease that cannot kill if it's treated. It's preventable if the patient takes the medication regularly. At first, I was fearful of the disease, but I saw that I can live.
But not all complete their treatments, fueling the country's challenge of multi-drug resistant TB. In this respect, experts say the race is on to develop quick and affordable resistance tests for all commonly used TB drugs. Naidoo says there are steps which can be taken to improve the outcomes, and she also supports a community-based approach.
We certainly need far more investments. We need better tools to fight TB. We need effective TB vaccines. The TB preventive therapy shouldn't rely on you taking one more pill every day for a year or 3 months or 1 month. A shot in the arm should be enough to prevent TB for the years to come. So we need more effective preventive strategies, and we need to enhance access to TB diagnostics into the community. People now need to present to a health service to have a symptom suggestive of TB or to be a high-risk contact in order to access a TB diagnostic. But if we identify high-risk groups beyond just those that have symptoms of TB, enhance access to TB diagnostic testing, we will enhance our reach of the TB program into the community, enhance the number of people that we find with TB, and improve TB outcomes and reduce transmission at the same time.
Ongoing clinical trials are evaluating the safety and efficacy of shorter regimens needed to eradicate the disease. Renee Heine, SABC News, Durban.